Welcome to the MD Edge Daily News for Wednesday, August 8th. I'm Nick Andrews.
And I'm Terry Rudd. Today, low disease activity may be a worthwhile goal for patients with lupus.
Also today, medical associations are calling on the Trump administration to change course on a key federal family planning program.
And later, from MD Edge chest physician, telomere length is linked to COPD exacerbations and mortality.
But our top story today begins with concerns over a proposal to level Medicare evaluation and management payments. The Centers for Medicare and Medicaid Services says a need to reduce coding hassles is driving its new proposal to flatten the 2019 payment for E&amp visits that are coded at levels 2 through 5. CMS outlined how the proposal would affect payment by using 2018 rates to model the change. The proposal would set the payment rate for a level 1 visit for new patients at $44, which is down $1 under the current methodology. Payment for levels 2 through 5 would be $135. Right now, payments for level 2 visits are $76, with payments gradually escalating to $211 for level 5 visits. Payment for office visits with established patients would be up $2 to $24 for a level 1 visit. Payment for levels 2 through 5 would be $93. Currently, level 2 visits with established patients are $45, rising to $148 for level 5 visits. The changes would come with a reduced documentation burden. Under the proposal, documentation would be the same for all visits from level 2 to level 5. The CMS proposal is earning a cool reception from some medical specialties. Dr. Angus Worthing is the chair of the American College of Rheumatology Government Affairs Committee. He says rheumatologists are concerned about the changes, given that they bill across the E&amp levels. That makes it difficult to determine a flat fee that would keep them from losing money. Comments on the payment proposal are due September 10th.
Is low disease activity effectively just as good as remission? For patients with systemic lupus erythematosus who achieve prolonged low disease activity, it might be. Their 10-year damage accrual was similar to patients in sustained clinical remission. That's according to Canadian research published in Arthritis Care and Research. The study defined low disease activity as a score of 2 or less on the Systemic Lupus Erythematosus Disease Activity Index 2000. The researchers assessed damage accrual, medications used, flare rate, and mortality in 267 patients who sustained complete remission or low disease activity status for 10 years. About 10% of patients achieved prolonged clinical remission, while about 18% achieved low disease activity. Patients in both groups were similar at baseline, but the mean prednisone dose was higher in the remission group. Also, more patients in the low disease group were taking antimalarials. Dr. Tselios Konstantinos is a researcher at the University Health Network's Lupus Clinic in Toronto. He says maintaining a state of low disease activity could be an acceptable target for long-term lupus management. Dr. Konstantinos also notes that the concept of low disease activity is relatively new in lupus. Because complete remission hasn't been strictly defined and is in fact rare, a more realistic target, such as low disease activity, may be of value in daily clinical practice.
Leading medical societies are calling on the Trump administration to withdraw its proposed changes to the federal Title X family planning program. They're calling the modifications a threat to essential health care for women. The Department of Health and Human Services proposed broad changes to Title X back in May. Some of the changes proposed would no longer allow staffers at Title X clinics to counsel, refer, or provide information to women about abortions. The new rules would also mandate that Title X clinics that offer abortions maintain a separate facility for abortion services. In a July 31st letter, the American Medical Association asked HHS to withdraw the proposal, citing concerns from the medical community. Dr. James Madara is the CEO and Vice President of the AMA. In the letter, Dr. Madara states that the AMA is very concerned that the proposed changes would undermine patients' access to high-quality medical care and information. It would also interfere with the patient-physician relationship and conflict with the physician's ethical obligations. Meanwhile, a group of 14 Democratic governors has threatened legal action if the Trump administration moves forward with finalizing its rule.
And finally today, from MD Edge chest physician, patients with chronic obstructive pulmonary disease who have shorter telomere lengths in their peripheral white blood cells may be at greater risk of exacerbations and death. That's according to research published in Chest. In the study, researchers examined the absolute telomere length of 576 patients with moderate to severe COPD. They found that the patients in the lowest quartile of telomere lengths had significantly worse health status and a higher exacerbation rate than patients in the higher quartiles. Patients with shorter telomere length had worse health status. In the placebo arm of the study, the exacerbation rate and mortality risk were significantly higher in the shorter telomere group than in the longer telomere group. However, these differences were not observed in patients taking azithromycin. Patients with shorter telomeres also had an 800% higher risk of total mortality compared with individuals with longer telomeres. That finding was only evident in the placebo arm of the study, not the azithromycin arm. Furthermore, patients in the lowest quartile had significantly lower forced vital capacity values. The researchers note that that finding suggests telomeres could be a biomarker of restrictive physiology. And that concludes this edition of the MD Edge Daily News. The Daily News is published bright and early every morning, so you can make the day's top stories a part of your routine. For MD Edge, I'm Terry Rudd.
And I'm Nick Andrews. The MD Edge SciCast is all new today. You can subscribe to the SciCast and the Daily News wherever podcasts are found.